Hello guys, welcome to my new video. So in front of you today I want to discuss the topic. This is very important topic. If we talk about the topic name is what is a thalassemia? How it is caused? What is the symptoms? So today I want to try my best to explain what is a thalassemia. A thalassemia is a basically genetic disorder in which our hemoglobin is not made properly. Hemoglobin make not improper or inadequate level. So we all know that hemoglobin play a very vital role in our human body. They provide oxygen to our body and excrete a carbon dioxide level. When a hemoglobin not working properly, then our red blood cells not working properly. So the main function of red blood cells is hemoglobins to provide the energy to all over the cells. In a case of thalassemia, a proper hemoglobin not formed. That's why anemia is happen in thalassemia patients. So if we do a clinical test every time a hemoglobin level below is drawn. Why? What is the reason behind this and how it is caused? The reason is that it is came as inherited main parents to offspring. In mostly it came from cousin marriage. Mean when in other countries the cousin marriage is common, then this thalassemia is came. In this case, alpha and beta thalassemia came. A hemoglobin is below down to the normal range. So, if we talk about the symptoms of a thalassemia patient, the symptoms of a thalassemia patient, the color is showing a yellow. The eyes look like a yellow color, look like a jaundice or bilirubin patients. And the other symptom is that the patient feel a fatigue, tiredness, his urine is dark and looks like a lethargic, shortness of breath happen, and every time patient feel a fatigue and sometimes a fever, and a heart rate increased due to the deficiency of oxygen, due to the deficiency of a hemoglobin level. So these are all the symptoms of a thalassemia patient. So what is the cure and what is the treatment of a thalassemia patient? A thalassemia is a genetic disorder. So a clinical test is recommended, HB electrophoresis. Basically, if this test detect the thalassemia positive or negative, so we suggest that if we talk about the clinically, a HB electrophoresis test is recommended before marriage. So, and the cousin marriage is the main reason for the thalassemia. So the doctors should be, what is the clinical treatment of a thalassemia? A regular blood transfusion happen. In this way a hemoglobin raised and the patient feel comfortable, and when the hemoglobin below down, then the patient also feel the same symptoms. A folic acid symptoms supplements given to the patient. A folic acid increase the hemoglobin level, and the patient feel comfortable when they receive a regular blood transfusion, when they receive the folic acid level. And in these patients the puberty goes happen into the late process, and his fractures are more common. His facial bones and temporal bones are not made strong, are not made up properly. So that's why it is came inherited. So I discuss about the treatment of a thalassemia, how it is happened, and it is estimated that if we talk about the 2021, almost 11,000 deaths happen in a worldwide. So that's why a lack of awareness of a thalassemia, a patient don't know about the counseling, don't about the communication, the patient don't know about the what is the side effect about the cousin marriage, and what test are given, what test predict that the thalassemia have or not. So I hope you like my video. I hope you like it. Thank you so much for your always a good response. Thank you so much for your always a good support. Be safe, stay blessed, be happy. Thank you so much.